हॅलो एव्हरीवन, आज आपण बघणार आहोत CHOचे टॉप 50 क्वेश्चन जे की तुम्हाला उद्याच्या एक्झाममध्ये फार उपयुक्त ठरणार आहे. तर तुम्ही जरूर हा व्हिडिओ शेवटपर्यंत पहा आणि हा व्हिडिओ जो आहे तुम्ही हा रिव्हिजन बेसिसवरती बघू शकता. कारण की आता 1 वर्ष आपल्याजवळ होता, तो 1 वर्ष आपण अभ्यास केला, पण आता ही जी वेळ आहे ती रिव्हिजनची आहे. आणि उद्याच्या एक्झामसाठी सर्वांना बेस्ट ऑफ लक. तर आपण आपला वेळ वाया न घालवता आपला फर्स्ट क्वेश्चन पाहूया. फर्स्ट क्वेश्चन आहे, a village has 20,000 population during 1 year. 200 new TB cases are detected. What is the incidence per 1000 population? Answer आहे 10 per 1000 population. Second question, in population of 50,500 people have diabetes on January 1 and 100 new cases developed during the year. What is the point prevalence on January 1? 1%. Third number, if prevalence of disease increase while incidence remains constant, which factor is most likely responsible? Answer आहे increased duration of disease or improved survival. हे जे क्वेश्चन्स आहेत हे रिसर्च अँड मॅनेजमेंटमधले आहे, जे CHOसाठी आपल्याला कामी येणार आहे आणि हे थोडेसे हार्ड लेवलचे आहे. पण जर तुमचा अभ्यास झालेला असणार तर हा तुमच्यासाठी एक ओव्हरलुक हे क्वेश्चनवरून जर तुम्ही केलं तर तुम्हाला नक्कीच याचा फायदा होईल. आपला फोर्थ क्वेश्चन आहे, अ स्क्रीनिंग टेस्ट हॅज हाय सेन्सिटिव्हिटी बट लो स्पेसिफिसिटी. व्हॉट इज इट्स मेजर ॲडव्हान्टेज? आन्सर आहे इट मिनिमाइज फॉल्स निगेटिव्ह रिझल्ट. 5. विच मेजर इज मोस्ट अप्रोप्रिएट फॉर इव्हॅल्युएटिंग द इफेक्टिव्हनेस ऑफ स्क्रीनिंग प्रोग्राम? आन्सर रिडक्शन इन डिसीज स्पेसिफिक मोर्टॅलिटी when appropriate and measurable. 6th number question, a test is positive in 90 out of 100 people who actually have the disease. What is sensitivity? 90%. 7. A screening test is negative in 95 out of 100 people who do not have the disease. What is the specificity? 95%. If disease prevalence increase, what generally happen to the positive predictive value of diagnostic test? 8th number question, if disease prevalence increase, what generally happen to the positive predictive value of diagnostic test? It increase. If disease 9th number question, a community report an usually high number of cases of actual diarrhea within a short period. What should the CHO do first? Answer, verify the outbreak and initiate immediate investigation and control measure. 10th number, which epidemiological study is the best for studying multiple outcome following exposure to a suspected risk factor? Cohort study. 11th number question, which study is particularly useful for investigating rare disease? Answer, case control study. 12th number question, what is the strongest measure of associate commonly calculated in cohort study? Answer, relative risk. 13th number question, what measure is commonly used to estimate associate in case control study? Answer, odds ratio. 14th number question, in an outbreak the attack rate among exposed person is 40% and among unexposed person is 10%. What is the relative risk? Answer is 4. 15th number question, what does the relative risk of one incidence? Answer, no associate between exposure and disease. 6th number question, what does the relative risk greater than 1 suggest? Answer, exposure may be associated with increased risk of disease. 17th number question, a patient with suspected pulmonary TB coughing in a crowded household, which intervention has the greatest immediate public health importance? Answer, promote diagnosis, initiate of appropriate treatment and infection control measure. 18 number question, a person with TB become sputum negative after treatment. Does this automatically mean treatment should be stopped? Answer, no, treatment duration must follow the recommended regimen. 19 number question, a child presents with cough and fast breathing but no chest intoning or danger sign. Under IMCI principle, what is the next step? Answer is, assess and clarify according to age specific criteria and provide appropriate treatment and follow up. 20 number question, a child with diarrhea has lethargy, sunken eye, inability to drink, and very slow skin pinch. How should this be classified? Answer is severe dehydration. Number 21. In severe dehydration due to acute diarrhea, which route is preferred for rapid fluid replacement when the client cannot drink adequately? Answer is intravenous hydration according to appropriate protocol. 22 number question. A several malnourished child develop edema of both feet. Which nutritional condition should be suspected? Answer is severe acute malnutrition with nutritional edema. Number 23. Which anthropometric indicator is practically useful for identifying acute malnutrition in children 6 to 59 months? Answer is weight for height, length of MUSC depending on the assessment protocol. Number 25. A pregnant woman at 34 weeks has BP 160 by 110 mm of Hg and severe headache and visual disturbance. What is the priority? Answer is treat as severe hypertension. What is the drug of choice for prevention and treatment of eclampsia seizure? Answer is magnesium sulfate. Number 27. A postpartum woman develop heavy bleeding with bogey enlarged uterus. What is the most likely cause? Answer is uterine atony. 28 number question. What is the first line immediate intervention for postmortem hemorrhage due to uterine atony? Answer is uterine massage and promote uterotonic management with emergency referral resection as required. 29 number question. A newborn is not breathing immediately after birth. What should be assessed first? Answer is breathing, respiration, and the need of immediate newborn resuscitation. 30 number question. A newborn is cold, lethargic, and feeding poorly. What should the CHO consider? Answer is possible neonatal illness including sepsis requiring urgent assessment referral. 30 number 1 question. Which indicator best reflect the risk of dying during the first year of life? Answer is infant mortality rate. 32 number question. Maternal mortality ratio is expressed per how many live birth? Answer is 1 lakh live birth. 33 number question. If maternal death decrease but live birth also decrease, proportionality can be MMR necessarily be said to have improved? Answer no. The ratio must be calculated using both maternal death and live birth. 34 number question. A community has high hypertension prevalence but very low treatment and control rate. What should be the CHO priority? Answer is strengthen screening, linkage to care, urgent support, follow-up, and risk factor modification. 35 number question. Which is modified major risk factor common to cardiovascular disease, diabetes, and several cancer? Answer is tobacco use. 36 number question. A patient with diabetes has a fasting plasma glucose repeatedly above the diagnostic threshold. What is the appropriate community level action? Answer is confirm, assess according to guideline, and ensure linkage to appropriate treatment and follow-up. 37 number question. Why is population level screening for hypertension important even when people are asymptomatic? Answer is hypertension is often asymptomatic but can cause serious cardiovascular, renal, and cerebrovascular complication. Number 38 question. Which approach is most appropriate for preventing complication of diabetes at community level? Answer is early detection, glycemic control, lifestyle modification, medication adherence, and regular complication screening. Number 39 question. A person sustained a dog bite from suspected rapid dog. What is the most important immediate first aid? Answer is immediately and thoroughly wash, flush the wound and soap and running water followed by urgent medical assessment for PEP. 40 number question. What should a bite wound not be tightly sutured before appropriate assessment? Answer is tight closure can interference with drainage and may increase infection risk. Wound management should follow appropriate protocols. 41 number question. A patient present after a suspected snake bite with progressive ptosis and difficulty breathing. What is the priority? Answer is immediate emergency referral and airway respiratory support with appropriate antivenom management. 42 number question. In suspected organophosphate poisoning, which clinical feature is characteristic of cholinergic excess? Answer is excessive salivation, lacrimation, sweating, bronchial secretion, meiosis and other cholinergic signs. 43 number question. A person develops sudden facial weakness and inability to speak. What should the CHO suspected? Acute stroke. 44 number question. What is the most important principle is in suspected acute stroke? Rapid recognition and urgent referral to stroke capable facilities. 45 number question. During a heat wave, an elderly person develop altered consciousness and very high body temperature. What is the most likely emergency? Answer is heat stroke. 46 number question. Which level of prevention aim to prevent complication and disability after disease has already occurred? Answer is tertiary prevention. Number 47 question. Vaccination against HPV primarily prevent which group of disease? Answer is HPV related cancer and other HPV related disease. 48 number question. A vaccine has high efficiency and clinical trial but low efficiency is community program. What could explain this difference? Answer is real world factors such as poor coverage, missed dose, cold chain problem, adherence issue or population difference. Number 49. During an outbreak, the CHO find that many cases occurred after consuming food from common source. Which epidemiological concept is most relevant? Answer is common source outbreak. 50 number question. A CHO has limited resource and must choose between intervention. Which principle should guide priorities? Answer is prioritize according to urgency, magnitude of health problem, risk effectiveness, equity and available resource. हे आपले आजचे 50 क्वेश्चन्स होते जे की तुम्ही बघितलेले आहे. यामधून हे जे आहे ते सर्व रिसर्च मॅनेजमेंटवरतीचे क्वेश्चन्स होते आणि हे थोडे टफ लेवलचे होते, पण तरी तुम्ही एकदा हे बघून देखील एक्झाममध्ये गेले तर तुम्हाला ह्याचा नक्की फायदा होईल अशी मी आशा करते आणि उद्याच्या एक्झामसाठी तुम्हाला